Okay, so let's try it out, okay? So if you're sitting on a chair at home, okay, so what we're gonna do here, so you're gonna sit on the edge of that chair, and again, we're gonna find the back of those sit bones by just slouching, and then I want you to find the front of your sit bones by sitting up in your best posture, okay? So just get comfortable with feeling the difference between the back of the sit bones and then the front of the sit bones. The easiest way to learn how to do these pelvic floor exercises is to start in sitting, but in a specific position. So what you'll want to do is lean forward, and you want your elbows to be on your thighs close to your knees. Okay. In this position, what happens is that the bum here is stretched. And if the bum is stretched, it makes it very hard to squeeze. Okay, you can't squeeze a bum if it's being stretched. And so that helps you eliminate the possibility of contracting your glutes and doing this whole thing wrong. Because remember, I mentioned just before we got cut off that technique matters. Okay, so again, everybody coming forward, making sure you have a flat back. Don't sit like this. Try and sit with your back nice and flat, sticking out that chest nice and proud. And what we're going to do here is we're going to all take a big breath in. So just pay attention, and it might be different for everyone, okay, because most people tend to breathe really shallow, which is something else that we cover in physio as we go over the breath, because it's extremely important. The breath is coordinated with the diaphragm. The pelvic floor and the diaphragm move together like a piston. And so if your breath is not working properly, if your diaphragm isn't moving properly, then the pelvic floor isn't going to have optimal capacity either. So coming forward here, just pay attention, take a deep breath in, and focus on where do you feel the breath in your body? Do you feel it in your chest? Do you feel it in your belly? Or do you feel it all the way down into the bum region, between that sit bone region? Try again, take a deep breath in and hold it. And just kind of pay attention. Where is that feeling going to? And then exhale, okay? So it should be coming into the abdomen. You should be feeling expansion in the belly when you breathe in. The belly should get big, and then when you exhale, the belly should shrink. And that's probably very backwards to a lot of people, because often we tend to suck in to look thin, or it's just a habit that people get into, is they suck in when they breathe in. And that, again, affects the function of the diaphragm. So again, trying to breathe into the belly, deep breath in. And then as you exhale here, you're going to count out loud for 10 seconds, and you're going to squeeze the pelvic floor. But remember, we're not doing it like women, we're doing it like men. So we're not Kegeling anymore, we're in fact Hegeling. And we've returned the name for men, a Hegel versus a Kegel, so that it is very different, okay? And so that we're not making the mistakes that we have in the past. So you're going to be imagining like you're stopping the flow of urine, you're lifting the penis, hands free of course, or in some cases the research even goes as far to say nuts to guts, because men tend to understand that nuts to guts. It's that pulling up of the testicles. So yeah, try, inhale, deep breath, and then exhale, nuts to guts, move the penis, lift the penis, hold it, and counting out loud for 10, 9, and you're sustaining that contraction, 8, 7, hold it, don't let it go, 6, 5, 4, 3, if you feel like you're losing it, tighten it up, 2, 1, and then slowly, slowly release. Now, why slowly release? Because if you don't slowly release, you might actually have leakage because you just contracted. And if you contracted improperly, you might be squeezing on the bladder. So you've got to be cautious on how fast you let go, and you've got to make sure that you sense that you're clear and it's safe to do so. Okay, so let's try that again. Inhale deeply, exhale, nuts to guts, or lift the penis with your mind, holding it, counting out loud, 10, 9, make sure you're counting out loud, because if you're not able to talk through this, that means you're holding your breath, and breath holding puts more pressure on the pelvic floor muscle that you're trying to use to stop leakage. Remember, that's just a little tiny circular muscle, and the less pressure that you impose upon it, especially immediately post-operative period, it's going to help, right? You don't want to put too much load on a muscle that's untrained. It's like trying to do, if you're trying to learn how to squat for the first time, you're not going to load your back with 100 pounds, you're going to learn how to do an air squat, right? So it's the same idea. You want to put as little pressure on that pelvic floor as possible, okay? Again, deep breath in. Exhale. Squeeze and lift, counting out loud. 10, 9, 8, 7, 6. Holding that contraction. Now, this is not 100% contraction. It's about a 30, maybe 40% contraction. It's not a 100% because you don't need to do that for this particular set of muscles that we're working, okay, the endurance muscles. They just need to be able to be held in a certain state of contraction for an extended period of time. Now, 10 seconds is what we start out with. That's not where you're going to finish. That's just the beginning. So you do 10 sets of 10-second holds with a 10-second rest in between. And you want to do that before and after lunch, before and after breakfast, before and after lunch, and before and after dinner. So that's 6 times in a day. And when I say 6 times, there is research where they've done 3 times a day. And it is about a 50% difference in improvement. So if you want to do 3 times a day, then that's fine, but expect 50% improvement. If you want to get better at 100%, then do the 6 times per day. And I'm going to go back and say what I said earlier. You have to train these muscles to fatigue. So like I said, it's not about going to pick up a dumbbell and then do 2 dumbbell curls and then go about your day, come back, 2 more later on, and then another 2 later on. It has to be done all in combined, right? It has to be done in one sitting, and it has to be done to failure. So you've got to feel like it's getting challenging to continue to do this exercise. Hopefully many of you are continuing to do your sets, so you can kind of knock one off for the day, and that you're challenging these muscles and you're continuing to work. And in the seated position, in this position like I discussed, it is the easiest position to learn. We do not want you to do it in line, because really, not many people leak in line. I do have some situations where that happens, but it's not very often, okay? So it's not really useful to do it in line, so try doing it in sitting. You get the support from the seat that helps lift the pelvic floor a little bit, and it does make it a little bit easier. But as soon as you feel that contraction and you're very comfortable with the sensation and what it should feel like, and you're able to do your 10 sets of 10-second holds, okay, then you want to progress to a more functional position like standing. Okay, but you've got to be mindful that when you're in standing, that you're not using your bum to squeeze those muscles. So I often tell men to stand naked in front of a mirror, a long length mirror, and stand naked there and watch the movement of the penis when you squeeze and lift the pelvic floor muscles. You should see the penis retracting in and then falling out. And remember, when you let go slow to make sure that you're successful. And then if it's not and you feel, oh, something's coming, then just draw back just a little bit and hold until the bladder quiets down and it gets the message that the bladder doesn't need to contract, okay? Because the pelvic floor muscle contraction actually sends a message up to the brain saying, hey brain, stop squeezing the bladder, it's not time to go. And so the bladder just backs off, and then you have success and no leakage. So I hope that makes sense, okay? And then after you've been comfortable with doing it in standing, then you start incorporating it into your activities of daily living. So let's say you have to walk up a flight of stairs. So contract the pelvic floor muscles, hold that pelvic floor contraction for the entire flight of stairs. If you have to go for a walk, that's another really important one, is you're going to want to go and you're going to try and sustain a pelvic floor muscle contraction at about 20 to 30% for the entire 30-minute walk. And as you're walking, you're going to feel that you're not sure anymore if you're actually still contracting. It's kind of like when you wear a ring or a bracelet or a watch, you don't know that you're wearing it anymore after a while, right? So it's the same thing, is that you're not going to be sure whether or not you're still contracting, so just squeeze a little tighter. That's all. And then continue on with your walk. And this is a really great opportunity to work the endurance of that muscle, because walking tends to be one of those things where lots of leakage happens, and it's very frustrating for men. And they tend to quit a little bit too soon. And really the take-home message here is not to quit too early, because it will become automatic, just like riding a bike, right? Just think about all the things that you learned to do that you don't even think about doing anymore. right? And sometimes it takes more time than others, but this particular exercise is going to take some time for it to become automatic. So you just have to be persistent with it. Okay, so that's the slow twitch muscles. Those are the endurance muscles, and they're really extremely important for your maintenance of continence throughout the day. And if you recall, we talked about how they fatigue out in the later half of the day, and that lying down and doing some stretches is extremely important and beneficial. That's going to help, but certainly over time, you may not need to lie down anymore because you will have built up enough endurance that this muscle is going to sustain you through the day. Okay, the fast contractions. So again, if you're a beginner, you can do it in this position here. Other positions that are not so bad are positions like this, which we call melting heart. Okay, I don't know if you guys can see me, but basically you're just down like this, bum is in the air. And why again? Because the knees are up towards the chest. Anytime your knees are up high and your bum is stretched, it's a good position. If you're really a beginner, then you can do the knee to chest position here. It really helps. Happy baby is another really awesome pose. But again, we want to try and train these muscles in more functional positions. Okay, so thinking about sitting and standing, those are when those muscles are needed and recruited. So the fast twitch. The fast twitch, I find this one to be easiest if it's done in standing, again, completely naked in front of the mirror, and just put a little sheet to catch some urine if you happen to lose any urine. Don't practice these exercises with your pad or your pull-up on, because then you're not really going to know how much leakage is actually happening, and you're not going to have that visual feedback. So in front of that mirror, you're going to contract the muscle quickly and then let it go. Contract quickly, let it go. And it's at a rate of 1 per second. So you have to get pretty quick at it, but don't forget, you also have to let go. So what I find with men is that they squeeze, 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 and they don't actually have the let go portion into that. And over time, that chronic squeezing, 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 and not letting go could actually lead to pain. And if that's something that you do feel over time, you'll want to definitely speak to your therapist about that, because it really is a situation where your pelvic floor muscles become hypertonic or too high-toned, and you have to learn how to let them go again. And that happens in some men. So sometimes even years after they've kind of managed their incontinence, they have this perpetual habit to hold for dear life all day long because they're so afraid to leak. And they forget that they have to let go of the pelvic floor as well. Okay, so that's the reverse Kegel, or I should say reverse Kegel. So again, let's try it in a simple version here, or if you're more advanced and you've done these before, then feel free to do it in standing. You're just going to lean forward. And again, we're going to do the same thing. You're just going to 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And count out loud so that you're not holding your breath, because you'd be surprised how often you hold your breath. And that's just going to make it even harder. And with these ones, you're going to do 3 sets of 10, okay? And in the middle, you want to have double rest time, because you need to give the power muscles sufficient time to recover so that they can perform effectively again in that next set. So if you asked a sprinter to sprint, 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 and you never gave him or her a chance to rest, then their performance is going to deteriorate over time because they're inserting themselves to 100%. Right? And these muscle contractions, when you're doing the fast twitch muscle contractions or the power muscle contractions, these are 100%. Okay? And so it should feel different. And if you're not feeling the difference yet, if you're doing your slow twitch muscle contraction, you're feeling like, okay, that feels the same as my fast twitch, then you've really got to modify what you're doing for your endurance, because your endurance should feel significantly less, like 70% less than the full contraction. And that's actually an exercise that I teach my men called the elevator. And the elevator is the ability to contract the pelvic floor to 25, 50, 75, 100, release to 75, release to 50, release to 25, release to 0. And it's being able to go up and down that elevator and work on that contraction strength. So hopefully while I'm doing that with you guys right now, I know I'm doing it, I hope all of you guys are doing it as well, but hopefully you can feel the grading system that your pelvic floor muscle can go through, the full range of motion that's available in there. And again, don't get discouraged. These are muscles that you've probably never been exposed to in your entire lives. And now all of a sudden you have to figure out how to use them. So it will come with training. And if you're having a difficult time, then just contact me or a pelvic floor physiotherapist that's nearby you that hopefully obviously specializes in men's health, because there's not a lot of us out there, unfortunately. So make sure that they are definitely well-versed in that area. And that's basically it, guys. That's really the two types of contractions that need to take place. When you get more comfortable with your fast twitch pelvic floor muscle contraction, you can add a cough, okay? Because coughing and sneezing, lifting, bending, those are all activities where you'll notice leakage happens, right? Because that remember we talked about stress incontinence, how it's an increase in intra-abdominal pressure on the pelvic floor. So a cough creates a lot of downward pressure on the pelvic floor. And so if you want to try standing up, and what we're going to do here is we're going to cough. So we're all going to take a breath in and cough. Now, how many of you just coughed and didn't even think of their pelvic floor? I usually have a ton of people that say I have and that they leaked. And if that was the case, it's because you didn't think of contracting the pelvic floor. Now, I just gave a really aggressive cough. If you find that the aggressive cough is too much, then just soften the cough. Just try something a little bit less and work up to it. You don't want to blow past what your current ability is, because your body is just going to go recruit different muscles and you're not going to strengthen the muscle that you need. So I can't enforce enough how much technique matters. Okay? All right. All right, so some take-home message. Again, I'm going to say it, technique matters. We're Hegeling, we're not Kegeling. Intensity matters. You have to train to fatigue, so you've got to sit down and do it all in 6 times per day. Okay, not once, not 2, not 3. Well, you can do it 3 times and get 50% improvement. But if you want 100% improvement, then do it 6 times per day. And also, I didn't mention previously, but the training is one thing. So that's 6 sets per day that you're doing. That's just one thing. But you got to put that into play. So when you're doing stuff, activities of daily living, let's say you have to lift a heavy box or whatever it is. Well, that's a great time to practice your pelvic floor muscle contraction. Because whenever you have a leak, that should be an indication right then and there that you have to stop that activity and redo it with a pelvic floor muscle contraction so that you don't have the leakage. And if it happens with the weight that you've selected, then redo that exercise with a lighter weight until you become successful at heavier and heavier weights. But don't blow past what you currently can do. Okay? Then also, if you're one of the few that get a referral from your doctor 6 weeks prior to having your surgery done, it's fantastic, because here, just like any other surgery in your body, if you were having an ACL repair or a shoulder repair, the surgeon says, go see physio, strengthen the area before, and your outcomes will be better after. Why on earth that's not being done commonly across the medical field right now for pelvic floor surgery, I have no idea. Because there is lots of research that shows if you do it preoperatively, you will have less instances of incontinence and erectile dysfunction. So if you know somebody who's going for prostate surgery, let them know before that they should go see a pelvic floor physio to get this whole process started, okay? And as I mentioned, if you experience pain, it's because you're not letting go completely, and those muscles have to move through their full range to be completely healthy and functioning properly. I have this little picture here of my little golfer guy, because a lot of men golf, and any man who golfs or female who golfs, you know that if you swing harder, that is going to make your ball flight way worse, right? So it's not about how hard you do it, it's about how well you do it, okay? And so that's why I have my little golf there picture. And then so before surgery, you want to make sure that you're doing those pelvic floor muscle exercises, the 6 sets per day, before and after breakfast, lunch, and dinner, like I mentioned. Then you're also doing your cardio, then nutrition. You want to make sure you're eating healthy, you're drinking plenty of water, and that is an optimal time to work on urge suppression techniques, because we rarely use that external muscle when we have the internal sphincter in the prostate there. So before you get it removed, if you feel like you need to go, instead of going, contract your pelvic floor and work it. So now you're dealing with a full bladder that's weighing down on that muscle, and over time that muscle is going to get stronger. And why 6 weeks? Because it takes 4 to 6 weeks for muscular development to occur. So we need at least that initial phase to give us the advantage afterwards. And then erectile function, yes, you should be having several erections per week, at least 4 to 6 preoperatively. You've got to keep that function alive in your body, and you're trying to achieve at least 3 orgasms per week, okay? Whether that's with your partner or independently, it doesn't matter, but it should be done to keep that erectile function alive and then returning quicker post-operatively. And post-operatively, no pelvic floor muscle exercises when the catheter is in, okay, but once it's out, boom, you restart the protocol immediately. And then, as I mentioned, you incorporate those pelvic floor exercises in all your activities of daily living. You work on the bladder retraining by removing those bladder irritants, increasing the water, practicing those urge suppression techniques, lying down for an hour every day. And then just a few exercise guidelines. You shouldn't be doing a whole lot more than walking for the first 6 to 8 weeks, okay? And no lifting more than 10 pounds for 6 to 8 weeks either. So that is important, because if you remember the image where the bladder neck was reattached to that muscle, there's only 6 small sutures. When I was in the OR room watching the robotic procedure done, it's absolutely fascinating. It's amazing what technology can do nowadays, but it is literally 6 small sutures that keeps the urethra and the bladder and the membranous urethra, the bladder neck and the membranous urethra together. So I wouldn't lift more than 10 pounds. That was really my aha moment. Be mindful of that. And so things like gardening, shoveling snow, scraping your car, carrying grocery bags, things you don't necessarily think weigh, you got to be mindful of all of that stuff, okay? Returning to the gym about 12 weeks, and that's when we say that, we're talking about like heavier lifting, right? And then 3 months before resuming cycling. And as I mentioned, also avoid lifting loads that cause leakage, because you want to work up to that. So you're using the right muscle and not using compensatory muscles that aren't going to be effective anyways. All right, so that's the end of the presentation, and I'm happy to entertain any questions at this time, but I'd like to thank you all for your patience and your attention. It really means a lot to me, and I'm glad that I was able to share this knowledge with everyone. So if you have any questions, you can unmute yourselves. Can you guys do that?
Wondering where you get the penile clamp.
Where you get the penile clamp?
Yes, and the vacuum erection devices.
Yeah, so one of them is called Vacuum Erect. And again, you can look at these online. You can get them on Amazon, Google it. Amazon has everything pretty much, but the Vacuum Erect pump is one of my favorites, but there are other ones there too. Vacuum erection devices. You just have to kind of, they're all over. I do sell them in my clinic, but if you don't have the ability to come to my clinic, then you can find them online under Vacuum Erect. That would be the one that I recommend. And then the penile clamp, again, just Google penile clamp. Pardon me? Do I have any other questions?
Christine, can you tell us how much they are? Because I've been to you, so I know where you are.
Okay. How much is the vacuum erection device?
Yes, please.
Yep. So those range upwards of $350. And the Manta actually was the other thing that I showed you guys. Yes, this guy here. This guy I think is almost $200 after taxes. But I have to say, like, the men who have tried this, they really, really enjoy it. Beyond any other vibration device they've ever had, it's one of their favorite. So
Yeah. Oh.
Any other questions?
I'm unmuted.
If you're not asking a question at this time, would you mind muting just so that we don't get feedback?
Are you sure? Back it on? Right?
I'm not sure whose mic is on like that, so.
Turtles?
Oh, I think I found them. All right. Do I have any other questions? If I don't have any questions, I have a question for you guys. And I'm really one for positive criticism. I understand I had a technical glitch here that I did not forecast, and that's just because I'm doing this by myself, and I just thought I'd try to do something that I'd never done before, so I've learned from that. But in terms of the content and anything that you could just provide me with some criticism, because I am going to be doing this with Prostate Cancer Canada. And I'm going to be providing this presentation for them, which is a really incredible opportunity for me. It's even more important because full disclosure, I applied for my PhD because I wanted to go back and advance men's health, because it lags behind that of women's by approximately 40 years. And there aren't many people who are doing much for men's health. And I happen to be one of the few that really had so much passion, and I was really looking forward to going. But anyways, I got, okay. I was unfortunately not accepted this time around, and I'm hoping that Prostate Cancer Canada will provide me with the funding that I believe is where I was really lacking. And I later came to find out that it's a business just like any other business out there, and if you don't come to the table with money to help fund your research, then they're obviously not going to necessarily find you as attractive as perhaps other candidates. And so I really would appreciate any advice from anyone who took the time to listen to this today and give me some feedback as to perhaps where was it too much? Was it too little? Did I miss stuff? Do you wish that I would have mentioned certain things? Is there any feedback at all that can help me increase my chances at perhaps getting that funding from this organization? Sorry, I got a little emotional there. It really meant a lot to me. So, and I tried really, really hard. It took, but I learned so much, and because of it, I actually put this presentation together. So there was a lot of good that came from my willingness to try. I don't consider it a failure. I just didn't make it this time. And my mom sends me a text and she's like, well, you know, Albert Einstein didn't get accepted the first time he tried for his PhD too. So that made me feel better, along with Dr. Polgar, who also said the same to me. So I guess sometimes you just got to keep trying. But if you feel like you have any feedback and you don't necessarily want to share it here, I'm okay if you want to maybe send me an email and let me know privately if that's more so how you'd rather communicate with me. Everybody's so quiet. Okay.
Are you still seeing patients during COVID, Christina?
Yes, I am. We're essential services. Okay. I guess we'll leave it at that. And if you can provide me with a few things that I did well via email, or a few things that I didn't do so well at, I would really, really appreciate any feedback that you could give me. And if you found it helpful and beneficial to listen to, then that would also be great feedback to get to.
I'm just going to pipe in for a second. For anybody that doesn't use Christina right now, I'm a year and a half post-surgery, and she's helped me immensely. So if anybody needs the help or wants the help, definitely use Christina. She'll get you through it.
Thank you so much. Appreciate that. Okay, guys. Well, again, thank you so much for your time today. It was great seeing a lot of people that I haven't seen in a long time. I hope everybody's staying safe, and let's hope that this COVID thing ends soon so that we can all get back to our normal lives. It was great seeing you all again.
Yeah, thanks for coming back for part 2 today. It was good to see you.
Yeah, sorry for the glitch.
No, that was okay. It was a little break in between without warning, eh?
Right.
Thanks.
Thanks, Christina. You've done a lot for me and making me better. Thanks for all your hard work.
Thanks so
for
much.
today.
Thank you so much, guys.
Cheers.
Bye for now.
Enjoy the rest of the weekend. Yep. See ya. We'll be-
Thank you, Christina.
You're welcome. Bye.
Bye.
Thanks, Christina. I thought the presentation was great.
Thank
We didn't sign in till about 10 minutes ago. We missed the recall to come back for the second part. So we missed, you said you were going to do a bit of a handout?
Yes, I'm actually going to, sorry, who's speaking right now? I can't see you.
It's Cindy and Jim Vink here. We turned our video off
yes.
to save time.
Yeah, no, that's okay. Yeah, I can definitely send the presentation over to you. Absolutely no problem at all.
That would be wonderful. Thanks. And we're interested in one of those mantas, I think. So
Okay.
some arrangements to maybe come and pick one up from you.
Yeah, absolutely. I haven't seen you guys in so long.
Jim has to get back to doing his exercises again.
Uh-oh, Jim.
We had a little bit of a setback after the removal. Then this past summer, I had to go through radiation therapy, so we had a little bit of a setback there.
I'm so sorry to hear that, Jim.
Doing really well, though.
Okay, good. So with radiation, like I would suggest maybe coming to see me for an appointment so that we can talk a little bit about that, because it's a little bit of a different situation.
Yeah, I'm okay with that. I'd be happy to make an appointment with you and tell you how things worked out for me. And by the way, for those that are listening, Christina did wonders for me as well. I did the pre-op, and then, which it helped me immensely in terms of bladder issues or leakage. I have next to none compared to other people that I have heard that had it done and had a lot of problems. I do not and did not have that problem, most probably because of Christina, without a doubt.
Thanks, guys. So Cindy or Jim, you guys will call the clinic. Do you have my clinic number still?
Yes, we do.
Okay, perfect. So yeah, just give me a shout and then I can book you guys in, or you can try to book in online. Do you know how to do that?
Yes, you are still using the Jane app?
You got it. Yep,
Hey, can I pipe in for a sec?
absolutely.
I just want to say that I didn't know about Christina until almost 8 years after the prostatectomy. And I had erectile and I had leakage issues. And after 8 years, after spending time with Christina, I'm almost back to normal. So
That's wonderful. That's wonderful.
that's 8 years, and I should have been referred a long time before that, but I wasn't. So it still works after many, many years.
Yay.
Okay, you've given me renewed hope now.
All right.
Thank you for sharing that, Dr. Polgar.
Okay. All the best, everybody. Have a nice weekend.
Okay.
Thank you.
Thank you.
Thanks, Christina.
Bye, Mike.
Thank you.
Mike.
Hey, Mike. Nice to see you, Mike.
Yeah, hi, Alex.